almost all Americans are going to suffer one episode of severe back pain in their life at a minimum. One of the things that you have to think about is your fitness. If you have extra weight, if you're carrying extra weight in the front especially, it's important that you try to optimize your physical fitness because, like I said before, the last thing you want to have is an operation. Sometimes surgery is the best choice left, but it's always the last choice. Things that you can do to avoid having to have surgery, potentially, not always, but potentially, is to make sure that you keep your weight in check. You want to keep your core muscles strong. If you're carrying extra weight, you want to get into a routine of physical fitness that minimizes impact across your spine if you're having back pain. So there are a lot of different exercises out there that people try to do that actually increase the risk of injuring your back. Anything with a lot of impact, or cheat sets, or throwing weights around, anything where there's plyometric activity. If you're carrying a lot of weight or if you have bad discs, you want to avoid a lot of impact. So I want people to realize that you can get fit in a way that may still protect your spine. So walking, fast walking, elliptical, swimming, cycling, all those things to get fit. You want to exercise with weights. You want to build muscle. You want to stay flexible. You want to stay limber. You want to stretch every day. All those things help you to avoid having progressive worsening of your back pain. If you're in a position where you're carrying extra weight, I always recommend, I'm kind of an old school guy. There's a lot of different ways to get fit. A lot of people like the keto diet. People like the paleo diet. There's so many diets out there. Intermittent fasting is kind of a new rage. There's a lot of ways to boost your metabolism. The way that I stay fit at 49 is that I try to stay true to kind of old school, tried and true techniques that have worked for me. Everybody's metabolism is different. Everybody's body responds differently to different programs of exercise and diet. So you have to kind of play with it and see what works better for you. Some people need no carbs. Some people actually need carbs. So you have to realize that your genetic makeup is different than everyone else's. So look at what works for you. For me, I modify my carbs. There are days where I eat high carbs, days where I eat low carbs. I always have high protein, no matter what, high protein. High protein is the key. I think high protein helps us to maintain and build muscle, having muscle mass, so lifting weights. My favorite is old school bodybuilding, helps maintain your resting metabolic rate. For every pound, you burn 50 calories a day. So every pound of muscle is very effective even at rest at burning fat. So you want to build muscle. But if you're doing it in a way that creates more trauma, then you're not helping yourself. You want to make sure that you use really good mechanics, really good technique, really isolate, hold your core. Build your core, build your flexibility. If you're working on losing weight, you want to do things like walking, cycling, elliptical, careful aerobics, careful yoga. You may not be able to do everything in yoga, may not be able to do every exercise in Pilates, but those exercises are very effective in building strength and flexibility in a very good balance, a very good combination. I recommend massage therapy. Massages really help to loosen the muscles. But in addition to that, you want to maintain your flexibility on your own. The other thing that I tell people to do when you're trying to lose weight is watch how you're eating. I personally will eat 3 meals a day, and I try to watch how I eat. I'm real careful about snacks and sweets. I try to have real lean sources of protein. Every once in a while, red meat, mostly chicken. I'm not a huge fan of fish. I do love seafood, but for me, I eat in a way that I'm always watching. If I eat any desserts, which is very rare, then I'm super careful about what I do the following couple of days. For me as a spine surgeon, I actually have to be relatively physically fit in order to do the job properly. When I do an operation, I have to retract the muscles. I have to literally put screws in by hand. And if you don't have the physical stamina to do that, then what you'll see a lot of times is instead of screws going in the perfect angulation to match the anatomy of the bone, is you'll see screws that are straight. The problem with that is that those screws were put in straight because the surgeon either didn't realize or they didn't have the strength to realign those screws to the natural anatomy of the spine. The strength of those screws, the fixation that you get from screws that are placed straight instead of converging at the tip, is at the minimal improvement in pull-out strength that you have decreased strength and resistance to movement. Because those straight screws aren't as able to resist stress, they're more likely to loosen. The surgery is more likely to fail. So for me, I want to make sure that I'm matching the anatomy, that I'm getting my screw in a very specific angle at every level. So I have to stay fit. I have to work out. I lift weights. I watch how I eat. I actually stretch all the time. My back gets tight because I'm leaning over patients all day long. So when I'm doing surgery, I have to be in a position where my muscles can withstand the stress of leaning over a patient sometimes for 12 to 15 hours and even longer a day. So those are all the same tips that I follow, that I give my patients, because I actually practice what I preach. And because of that, I created a whole line of nutrition products that I believe in, supplements that I take, and a whole line of products called Serum D Nutrition, because I wanted to make it easy for my patients. Every time I tell my patients what to take after surgery, or what to take before surgery, and what to take to lose weight in lieu of surgery, I'm always pointing them in multiple different directions. And I figured, well, gosh, I've been doing this for 17 years, and I know what supplements work, and I know how they work, and I understand how they impact the body. I've studied that specifically on my own since I was 14 years old as a football player, and as an aspiring weightlifter, and then later on as a spine surgeon who wanted to be physically fit so that I could play with my kids and I can actually do my job well. I've actually done a lot of independent research about what supplements work the best. And so I'm creating a line called Serum D Nutrition that will have all the products that I take myself, all the products that I think will help patients to maintain a fit body and to recover from surgery.